Hello, my name is Sloane Coffey.
Hello, my name is Kylie West.
We're currently research assistants under Dr. Rodney Roosevelt and Dr. Jordan Thibodeau at Arkansas Tech University. Our research this semester has focused on the effect of internal speech on approach and avoidance of alcohol cues. Experts on alcohol use agree that consuming over 4 standard alcoholic beverages, for example, a shot of liquor or a pint of beer, on average, is considered risky drinking and leads to detrimental health outcomes and behavioral choices. Research studying attention to alcohol shows that adults reporting risky drinking behaviors tend to prefer attending to alcohol cues when compared to adults who do not report risky drinking behaviors. And alcohol cues trigger increased behavioral approach motivation in college adults who drink socially. The current study builds upon the previous studies by including the element of self-talk and the effect of this speech on approach and avoidance of alcohol cues.
We defined self-talk as behavioral messages which can be delivered to direct attention to alcohol cues. It is hypothesized that repeating pro-drinking messages would increase approach to alcohol cues, and repeating anti-drinking messages would increase avoidance of alcohol cues. We recruited 11 participants in the pro-drinking condition and 17 participants in the anti-drinking condition, for a total of 28 participants with usable data. There were 5 males, 25 females, and 3 participants of an unreported gender. Participants were 64% white, 12% Black, non-Hispanic, 16% Hispanic, 4% Asian, and 4% other. This is reflective of the local college population.
Participants completed a standard alcohol dot probe attention task. On each trial of the task, see Figure 1 for a visual, participants repeated messages while responding to 2 different types of images presented immediately after a fixation cross. Participants then reacted to the probe on either the left or right side of the screen, which appeared behind the alcohol stimulus or opposite the alcohol stimulus. These images were similar in composition, but one image contained an alcoholic beverage and the other contained a neutral stimulus, such as a coffee mug or a toy. Participants heard a brief audio message pertaining to alcohol at the onset of each trial, which lasted from 1 to 2 seconds. In the pro-drinking message condition, participants heard messages pertaining to the positive effects of alcohol consumption. For example, I feel great with alcohol. In the anti-drinking message condition, participants heard messages pertaining to the negative effects of alcohol consumption. For example, I feel terrible with alcohol. Note that participants repeated the messages aloud with every trial. This was done to make sure the participant acknowledged the audio stimuli. We operationalized approach to alcohol by the reaction time to the probe. Approach to alcohol data were calculated by averaging the difference between reaction time to critical trials when the probe is presented on the same side as alcohol or the opposite side.
A visual of our participant flow can be seen in Figure 2. Prior to completing the dot probe task, each participant completed a self-report survey, asking about risky behaviors concerning alcohol and substance abuse. For the purposes of this study, we were only interested in the number of alcohol drinks an individual reportedly consumed in one sitting, and in the past 2 weeks as a measure of risky drinking. Participants were then assigned to their drinking message condition, pro or anti, and then completed the dot probe and were debriefed. The test of our primary hypothesis, seen in the data from Figure 3, revealed there was a faster approach on average to alcohol in the anti-drinking condition than in the pro-drinking condition. The result was statistically significant. However, the difference between conditions in alcohol approach was small, as suggested by the error bars. Figure 4, a Violin plot of the variability in the data, shows more variability in the anti-drinking condition, where some respondents were higher in alcohol approach, while other responses were lower in alcohol approach. The pilot data we collected supports the opposite outcome from our initial hypothesis.
The results show approach to alcohol increased with anti-drinking messages, which should have promoted avoidance. One potential explanation for our findings is based on behavioral approach theory, which suggests that some individuals, when experiencing heightened attention to appetitive or rewarding stimuli, have difficulty unlearning prior learned associations with alcohol. This is also known as resistance to extinction. In addition, we speculate the forced inhibition of unwanted internal self-talk, as we had participants repeat external messages, could backfire and increase the attention of to-be-inhibited thoughts. We plan to pursue more research regarding the effect of behavioral messaging on alcohol cues. We intend to further this research by including physiological data. We plan to use an EEG to measure approach and avoidance states with alcohol.